Meanwhile, doctors and other healthcare workers say they're struggling to care for patients due to multiple changes in restrictions. I want to bring in Dr. Bhavik Kumar, an abortion provider, speaking on behalf of the Committee to Protect Healthcare's Reproductive Freedom Taskforce. He's also the Chief Medical Officer for Planned Parenthood of Greater Ohio. Dr. Kumar, thanks for coming on. I know you provide medical care, including abortions in Ohio, but you also work in Texas, where abortions are outlawed with few exceptions. So what are you seeing in your practice, and how are these restrictions affecting how you provide care for your patients?
Yeah, good morning. I've been in Texas for a number of years providing abortion care, and we've dealt with a number of restrictions, including Senate Bill 8 and then Dobbs' decision, which has really shut down most, if not all, abortion care in Texas. And I also work in Ohio, where many of those similar restrictions have been taken down. What I've seen in Texas is that people continue to need access to abortion care. Unfortunately, they're not able to get that care here in the state, so they're being forced to travel to other states if they're able to. Many people are not, and that means that they're forced to continue those pregnancies against their will. And most of those people are forced to give birth and parent children that they know that they can't provide for. So folks that are sick, it's even scarier because we're not able to get them the care that they need. And sometimes they're getting sicker, closer to death before physicians and healthcare providers can intervene. And that's precisely what we as healthcare providers don't want. We want to prevent those outcomes. We want to help people make sure that they're healthier and better and able to exercise their rights to their own body and make their own decisions.
Now, former President Trump has accused Democrats of wanting to allow abortions up to and including the 9th month of pregnancy. And so far, the Harris campaign hasn't voiced support for any abortion restrictions. So from a medical standpoint, what's your view on performing abortions that late in a pregnancy? And do you think it's possible to impose any abortion restrictions without jeopardizing the medical care of pregnant women?
Yeah, what I would say, as somebody who does provide this care and has seen thousands of people, has had the privilege of taking care of them, hearing their stories, their names, is that I know that people that make decisions about abortion are making thoughtful decisions. They're considering what's best for them, their family. They take these choices and decisions seriously, and they're putting a lot of thought about what's best for them. It's also important to note the fact that about 92% of abortions are really early in the first trimester. So this is definitely a political talking point when we start talking about later abortion. Ultimately, as a physician who has heard thousands of stories, I trust my patients to make the decisions that are best for them at any point in pregnancy. But we really have to talk about the reality of what's happening with abortion bans and restrictions, where people don't get access to the care, and really move away from these divisive conversations about later abortions, because it really is designed to evoke emotions and other things. And we're not really talking about the reality of what's happening when we ban abortion, which is that people aren't able to exercise their rights to their own body and make decisions that are best for them and their families.
So do you see cases where it's medically necessary to perform an abortion later on in the pregnancy at that stage?
Yeah, of course, with the states where I provide care, we're providing up to the state limit. So in Ohio, that's 21 weeks and 6 days. Texas had a similar law, but now there are 3 abortion bans. So it's rare for many of us to see abortions that are that late in pregnancy, especially where the folks in the political realm were talking about it. However, there are places in the country where we can refer folks and that care can be provided safely. But again, it's a pretty rare circumstance where that happens, and 92% of abortions are happening in the first trimester.
And Dr. Kumar, very quickly, I'm out of time, but I just want to ask you, some supporters of restrictions say it's not just about protecting the life of the fetus, it's about protecting the mental well-being and physical well-being of the mother because of the repercussions abortion can have. Can you just quickly speak to that?
Sure. We know from studies that when we deny people abortion care, they do have worse outcomes, both for their physical health and their mental health. So abortion actually saves lives and makes their outcomes better, but also makes the outcomes for the children that they probably have at home better as well. So we know this information, and it's important that we remind ourselves about it, especially when we're 2 weeks away from the election.
All right, Dr. Bhavik Kumar, we appreciate your time today. Thank you.